Mackenzie, and I'm going to be showing you how to insert an NG tube today. So what you're going to want to do is you're going to want to assess your patient. You're going to want to ask them if they've ever had any previous head trauma, a deviated septum, or any nasal surgeries. Now you're going to want to assemble your equipment, which I've already done, and then you're going to want to go back into your patient's room and identify yourself to your patient and identify your patient to you by asking them two patient identifiers, and then you're going to want to explain to them what you're going to be doing, how you're going to be doing it, and how they can help you. So after that's all done, you're going to assist your patient into a high phallus position, which I have already done, and then I'm going to wash my hands, provide the patient privacy, and put on clean gloves. Okay, I'm going to want to go ahead and make sure that I have the right size of NG tube for my patient, and when that is noted and correct, I am going to measure from the tip of the nose to the ear, from the ear down to the xiphoid process, and mark that with tape. Once that is done, I'm going to lay a towel across the chest to prevent messes. And now I am going to lubricate the tip of my NG tube. You want to do this over a trash can because it gets kind of messy. And you're going to lubricate the 4 inches. Okay, as you're inserting the tube, you're going to want to explain to your patient that they need to hyperextend their neck. So mannequins don't really do this so well, but we're going to pretend you're going to insert with a downward curve along the floor of the nasal cavity. Okay, as we're inserting, you're going to want to instruct your patient to just take nice breaths, be calm. Once your tube hits the oropharynx, you're going to have them lean their head forward. You're going to lean it forward and then have them take a drink of water. Typically they can help you with this part, but these arms don't move. So you're going to have them take a drink of water, and then you're going to insert a little more, and then you're going to want them to keep taking drinks of water and encourage them to swallow. When they swallow, you're going to insert 2 to 4 more inches with every sip of water and every swallow. So once you reach your marked portion, you're going to not permanently, just put some tape on the nose. If your patient's skin is really oily, you can wipe it down with an alcohol pad, and that helps the tape to stick. But for right now, this is just temporary, and I'm going to use my syringe, and I'm going to inject 30 mils of air, and this is just to check placement. So I'm going to inject the air. I'm going to listen to the abdomen for a whooshing sound. Okay? And I heard the whooshing sound, so that is one indicator that it is in the right, that it is in the stomach. Another way you can test this is to, again, attach your syringe, aspirate some stomach contents, and then use the pH paper and test the pH. If the pH is in, I think, between 1 and 3, that's acidic. If it is more alkaline, that means you're in the lungs, you want to retract your NG tube and start all over. Another way you can do this too, if you can't get any of the other methods to work, is an x-ray. That's probably the most accurate, but at the bedside, you can use the other measures. So now that I know it's in the right place, I can go ahead and secure the tube to the nostril. You're gonna go down, around, and back up, and then the same with the other side, making sure that there's no tugging on the tube, and that there's no pressure on the insides of the nostrils. And once that's done, you can take your gloves off, document all relevant data, and make sure your patient's comfortable with the tube and everything, and then you're good to go. Thank you.